So you came into my office this morning. Can you tell me some of your symptoms?
I'm having pain in the neck, pain in the shoulder, which then becomes tingling sensations, primarily in my elbow, radiating down to my fingers on both sides, just tingling underneath. I feel a loss of muscle strength.
Okay. So you work out now too, and when you work out you feel that it's weaker?
I have stopped working out because it hurts.
Okay. And then you also said something about when you sit, all of a sudden you start feeling tingling in your arm?
Yep. As I sit, even if I'm sitting straight on a chair, it'll start the tingling sensations.
Any vertigo, dizziness, anything like that?
No.
Pain in the hip? Or
A little bit of pain in the hip.
Okay. And something about the feet, you get some tingling?
Occasionally I'll get tingling around my heel and my ankle and my foot.
Okay. So what we're going to do is do an examination on this lady, and we're going to see what we come up with. I have an idea so far because it's all one-sided, and we feel that it's possibly a right-sided hemisphericity. So we're going to check this. We're going to start out by having you just stand with your feet like that, and we're going to have you close your eyes for a minute. We're going to see if she stands still or starts to move. So we can see her stability is off here. She's actually falling back and to the left a little bit. And if you look at her here, the shoulder is turned more forward too. And now I want you to open your eyes, and I want you to stand first on your right leg and lift your left. And then tuck your chin down. We can see her stability and balance is off here too. Now I'll have you stand on the other leg. Keep your eyes open. Tuck your chin down. She has a little better balance on that side. She's a little more stable, as you can see. Now both of you done. Now hold your hands out like this and just play the piano for me. It's a rock song, so you gotta go fast. Just kind of like this. You can start seeing her left hand is starting to be a little irregular there, slowing down. Do you feel that?
Yeah.
She's having more troubles with her left hand there. That's the side of the cerebellum, so that's not firing right now. You can put them both down. And she's getting a little more flexor tonus here on this side too. So now we're going to have you lie down here. So using manual muscle testing to see not only if she has a nerve impingement, what we're looking for is a decrease in reticular activation from the brainstem down. So we're going to test this side first. Hold your leg up. You can see she can hold that. And she's holding there. Hold your leg out. Good. Hold your arm in. So we're just going through some extensor muscles for the back and arm. Hold your legs right there. If we come to this side, hold your leg up. She's weak. And she has weakness. And hold. Hold your arm straight in. This is her latissimus muscle. That's weak. She's complaining about weakness in her hand. Hold this like that. It's weak. She was also complaining about her triceps not firing properly, so we'll test that. Bring your arm down and bend at your elbow for me, please. I'm going to push up. You hold your arm right there. Hold. You can see we don't have much strength there. We'll test some of her stabilizers, supraspinatus. Hold. The deltoid. So if your extensors aren't firing and feeding back information properly, your flexors get too tight. So then you get impingements up here, and you start having radicular pain into your arm. You get impingements back in the back of your arm, back in the triceps, where the teres major minor come together here. You get an axillary nerve impingement. Get a slip bicep tendon in your arm. Hold. So she starts having pain at her elbow and up in here. You get an impingement at the piriformis, and you also get an impingement down here where the peroneal nerve comes down. So you start having multiple symptoms, which is creating pain in many areas, and she starts having these diffuse areas, and it's like, what's the problem? Well, the longitudinal level of the lesion is actually at the area in the brainstem, in the mesencephalon, where the pontine medial reticular area comes together. And so what we're going to do are some things to work with this. And we've developed music therapy that will actually activate areas in the brain to make your muscles work better. So we're going to start with that. Hold on one second there, wherever it is. So by having her listening to this, it's going to fire into the vestibular cochlear nerve and start activating midline, lateral cerebellum, and reticular formation. We'll show you the difference that it makes after we do this. Plus we'll be doing some SLT blocking. We'll be doing some rehab with a vibroplate and some eye exercises. It'll make a big change in how she's feeling.